Welcome to another informative session. Today, we dive into the world of nursing with a focus on Nclex exam preparation. Specifically, we'll explore a question related to patient safety and infection control. Picture this. A nurse is caring for a patient who has been placed on contact precautions due to a methicillin-resistant Staphylococcus aureus, commonly known as MRSA infection. The question then arises, which of the following actions by the nurse is appropriate? First, we have option A, wearing gloves and a gown when providing care to the patient. Option A, wearing gloves and a gown when providing care to the patient is an essential practice to prevent the spread of MRSA. This is a standard precautionary measure that healthcare professionals should take when dealing with patients under contact precautions. Option B suggests placing the patient in a room with a patient who has a similar infection. On the other hand, option B, placing the patient in a room with a patient who has a similar infection is incorrect. Even though both patients have MRSA, co-housing can lead to cross-infection of different MRSA strains, thus worsening their condition. Option C, removing gloves after providing care, but before leaving the patient's room is also incorrect. Gloves should be removed after leaving the patient's room to avoid contaminating other areas. Finally, option D proposes washing hands with soap and water before donning gloves. Lastly, option D, washing hands with soap and water before donning gloves, is a good practice but not sufficient. Hand hygiene should be maintained before and after donning gloves, and other personal protective equipment should be worn when dealing with MRSA patients. Therefore, the correct answer is A. Wearing gloves and a gown when providing care to the patient is the most appropriate action for a nurse dealing with a patient under MRSA contact precautions. To summarize, this question tests your understanding of infection control measures and patient safety. It's essential to remember that gloves, gowns, and strict hand hygiene are crucial when caring for patients with contagious infections like MRSA. Practicing with such questions will undoubtedly help you better prepare for the Nclex exam. So, keep learning, keep practicing, and remember, patient safety always comes first. As always, it's been a pleasure sharing these insights. Until next time, continue to learn, grow, and excel in your nursing journey.